At 10:45? Okay. Okay. Testing, testing, one, two, three, testing. Testing, mic check. Testing. Testing, testing, 1, 2, 3, testing. Audio test. 1, 2, 3. Audio testing. 1, 2, 3. Testing, testing. 1, 2, 3. We will start in 3 minutes. Testing, testing. Good. Everybody good? Okay.
Oh, no, no, it's okay. I'm happy to move myself.
Okay. Good morning, everyone. Thank you for being here today. I'm Barbara Ferrer, the Director of the Department of Public Health. We appreciate that you've taken time to join us today. We're going to be sharing important information about our ongoing investigation and response to an unprecedented number of locally acquired dengue cases in LA County. I want to begin by extending my deepest gratitude to Mayor Estrada and the City of Baldwin Park, their city council, their city manager, for their hospitality and, more importantly, for their partnership as we collectively address this concerning situation. I also want to recognize and appreciate Supervisor Solis and her team for their unwavering commitment to protecting the health of all of our residents. Supervisor Solis, as you all know, has been a powerful leader, advocating for the resources we all need to be able to respond to public health concerns like the one we're going to be talking about today. And I want to thank Andrea Moreno, who's the district director for Supervisor Solis, who's here with us today representing the 1st Supervisorial District. And I want to thank Jason Farned and the San Gabriel Valley Mosquito and Vector Control District for responding immediately to the need for increased surveillance and for all of their efforts to help residents in the community reduce mosquito breeding sites. Today, we're going to provide an update on additional identified cases of locally acquired dengue in the city of Baldwin Park and what public health, the San Gabriel Valley Mosquito and Vector Control District, and the city are doing together to ensure that residents are aware of the situation and have the information they need to prevent additional transmission. To begin, Public Health initially reported one confirmed case of locally acquired dengue on September 9th, 2024, in a resident in Baldwin Park. This week, 2 additional cases have been identified in residents of Baldwin Park. These residents have no history of travel to areas where dengue is commonly transmitted prior to developing symptoms. As a reminder, dengue is primarily transmitted through the bite of an infected Aedes mosquito. This is not a disease that is transmitted from one person to another person. And although Aedes mosquitoes are common in LA County, cases of locally acquired dengue are extremely rare. With these 2 additional cases, this now brings the number of locally acquired cases in LA County in 2024 to a total of 3. Cases of locally acquired dengue were previously confirmed by both Long Beach and Pasadena in the fall of 2023. This is an unprecedented cluster of locally acquired dengue for a region where dengue has not previously been transmitted by mosquitoes. Almost all previously reported dengue cases in LA County have been associated with reported travel to a country where dengue is commonly spread. These additional cases of local virus transmission are an important reminder for all of us in LA County that simple steps to prevent mosquito breeding and mosquito bites can lower the risk of mosquito-borne diseases like dengue and prevent more sustained transmission in the future. Public Health is conducting door-to-door information with the local vector control agency to enhance surveillance and engage residents in the immediate vicinity where cases have been identified. Outreach teams have been visiting and will continue visiting residents in the neighborhood of the identified case to share information about dengue risk in English and Spanish and other languages as needed, and encourage residents to take protective measures against mosquitoes. Our teams are also offering free dengue testing to all the households they visit. With the detection of these 2 additional cases in the region, Public Health will expand our outreach response to the additional households who are within an 150-meter radius of the newly identified cases. It's 150 meters because this is the typical flight range of mosquitoes that transmit the virus. If our public health team visits your home, please allow them to share information with you and help us by responding to a short survey to assess if anyone in the household has symptoms or a recent history of travel. Public Health is also sharing information with providers and encouraging them to stay vigilant for dengue fever and to test for and report suspect cases of mosquito-borne diseases. While the widespread transmission of dengue remains low, we do urge residents, particularly in Baldwin Park, to take simple steps to reduce exposure to mosquitoes. These include using insect repellent to prevent mosquito bites, and I have a little packet. Pretty easy, need to put it on when you're outside. We also say eliminate standing water around your house where mosquitoes can breed. They can breed in a sort of thimble full of water, so you got to get rid of all of the water. And keeping your house mosquito-free by using or fixing screens on doors and windows. I'm now going to turn it over to Dr. Halai, who will provide additional information on dengue symptoms and transmission.
Thank you, Dr. Ferrer. I'm Ayman Halai, and I'm the director of the Vector-Borne Disease Unit at Acute Communicable Disease Control Program at Los Angeles County Department of Public Health. As Dr. Ferrer mentioned, the cluster of locally acquired dengue cases is unprecedented because it has never occurred before in LA County or in California. Dengue is a viral infection that is transmitted by 4 closely related but distinct dengue viruses: dengue virus 1, 2, 3, and 4. About 1 in 4 people infected with dengue will get symptoms, which can range from mild to severe. Symptoms usually appear within 5 to 7 days of a bite of an infected mosquito. The most common symptoms are fever with non-specific signs and symptoms such as a rash, muscle aches, joint pain, bone pain, headache, and pain behind the eyes. Symptoms of dengue typically last 2 to 7 days, and most people will recover in about a week. However, 1 in 20 people with symptomatic disease will develop severe dengue, which can be life-threatening. Severe disease can lead to severe bleeding, shock, respiratory failure, and organ impairment. Infants less than equal to 1 year of age, those 65 years or older, pregnant persons, and those with certain underlying medical conditions are at highest risk for severe dengue. Infection with one dengue virus usually leads to lifelong immunity from that specific dengue virus and short-term cross-protective immunity from other dengue viruses. This means that a person infected once can be infected again. Second infection with dengue is a risk factor for severe disease. However, any infection can cause severe illness. There's no antiviral medication to cure the disease. Treatment is supportive, consists of fever-reducing medications, management of complications, and fluid replacement to prevent shock. Severe disease requires hospitalization for appropriate management. There is one dengue vaccine, Dengvaxia, that has been approved in the United States, but is not recommended for US travelers or those residing in areas where dengue commonly does not spread. As dengue commonly circulates in the tropical and subtropical areas of the world, and LA County residents frequently visit those areas, travel-related dengue cases occur every year. In 2024, to date, Public Health has identified 82 cases of dengue associated with travel among LA County residents. This is higher than previous years and reflects the record number of dengue cases and dengue transmission occurring in Latin America and elsewhere in the world. Local transmission occurs when a traveler who has been infected with dengue while abroad returns to LA County and gets bitten by a local mosquito that then becomes infected. This now infected mosquito can then bite an individual that has not traveled, resulting in a locally acquired case. The transmission can increase rapidly if additional mosquitoes are infected that bite more people. Our goal is to prevent additional spread by identifying cases and by working with our vector control partners to reduce mosquito populations in areas where local spread has been identified. Locally acquired cases and outbreaks have occurred in other parts of the United States, such as Florida, Texas, and Hawaii. These have been relatively small and limited. At this time, this cluster in LA County also appears to be limited. However, our investigations are ongoing. In LA County, we also see West Nile virus. Although it is spread by a different mosquito than dengue, it also was a new locally transmitted mosquito-borne disease when it first emerged in LA in 2003. West Nile virus now regularly occurs and is the most common mosquito-borne disease in LA County. West Nile virus causes illnesses and deaths each year. An average of 55 cases per year of West Nile virus disease in LA County residents have occurred over the last 5 years, but this has reached over 300 in some years. To date, there have been 12 cases of West Nile virus in 2024. The increased presence of mosquitoes and the threat of mosquito-borne diseases changes the way of life for LA County residents who have not had to worry about these diseases previously. Mosquito-borne disease is a reminder that mosquitoes aren't just an annoyance, but can make people sick. It is imperative for all of us to take measures to protect ourselves and our families by using insect repellent and controlling mosquitoes in and around our homes. Thank you.
Can you spell your name, please?
Halai. Halai. That's my last name. Ayman. Aiman. I will pass it over to Jason Farned, who is the district manager of San Gabriel Valley Mosquito and Vector Control District.
Thank you, Dr. Halai. Good morning, everyone. My name is Jason Farned. I am the district manager for the San Gabriel Valley Mosquito and Vector Control District. The district is working closely with the Los Angeles County Department of Public Health to continue enhanced mosquito surveillance and control measures in the affected areas. In addition, we are actively engaging in public outreach and education to help residents eliminate mosquito breeding sources and protect themselves from mosquito bites. Our primary goal is to reduce mosquito populations as much as possible and to continue testing mosquitoes to detect mosquito-borne diseases. To date, all mosquitoes tested in the San Gabriel Valley have tested negative for dengue. Our team is currently conducting door-to-door property inspections in the impacted areas to eliminate mosquito breeding sites and to provide essential information on mosquito exclusion and bite prevention. If our staff visits your home, Granting access to your backyard will significantly enhance our ability to reduce mosquito populations and prevent potential infections. We remind residents that mosquitoes breed in standing water and only need 5 to 7 days to grow from egg to adult. So we urge everyone to follow 3 simple steps: tip, toss, and protect. Tip out standing water at least once a week. Even a small amount of water, like that found in a bottle cap, can grow mosquitoes. Toss any unused containers that may collect water in the future, and protect yourself from mosquito bites by using repellents containing EPA-approved active ingredients. Ingredients such as DEET, picaridin, IR 3535, or oil of lemon eucalyptus. And I cannot stress this enough. The best way to protect yourself from mosquito-borne disease is to prevent mosquito bites. And the best way to prevent mosquito bites is to use an effective mosquito repellent. For more information about our services and additional guidance on mosquito prevention, please visit our district website at sgvmosquito.org or give us a call at 626-814-9466. Thank you very much. And next, I will pass the mic over to Mayor of City of Baldwin Park, Emmanuel Estrada.
Good morning, everybody. My name is Emmanuel Estrada. I am the Mayor of Baldwin Park, and I want to thank you for joining us today. I want to extend my heartfelt thanks to our esteemed partners, Dr. Barbara Ferrer from Los Angeles County Department of Public Health, Dr. Ayman Halai from the Acute Communicable Disease Control Program, and Jason Farned, District Manager for the San Gabriel Valley Mosquito and Vector Control District. Your dedication to safeguarding our community's health is invaluable. As noted by previous speakers, the presence of locally acquired dengue cases is concerning, particularly since such cases are extremely rare in LA County. I want to assure our residents that the City of Baldwin Park is taking proactive measures in close collaboration with our county partners. We are working closely with the Los Angeles County Department of Public Health and the San Gabriel Valley Mosquito and Vector Control District to respond swiftly to this situation. Protecting our community is a shared responsibility, and I encourage all residents to take practical steps to safeguard themselves and their families. The simple actions discussed today can significantly reduce the risk of mosquito bites and prevent mosquito breeding. You may notice public health or vector control staff visiting neighborhoods, and I urge you to engage them. They are here to provide crucial information and support, and your cooperation can make a significant difference. The City of Baldwin Park is committed to ensuring that all residents receive accurate information and access to necessary resources in order to stay safe. Our goal is to protect public health, prevent further transmission, and keep our community informed every step of the way. Please stay tuned for updates from our local public health department, and don't hesitate to reach out if you have any questions or need assistance. Together, we can mitigate the impact of the situation and keep Baldwin Park safe. In closing, while the presence of locally acquired dengue cases is concerning, we are taking all necessary measures to address the issue and protect our community. Thank you. I will turn it back to Dr. Ferrer.
Thank you so much, Mayor, for being with us, but more importantly, for the partnership. It's now my honor to go ahead and introduce Andrea Moreno, who's the District Director for Supervisor Solis. And as I noted early on, Supervisor Solis has been one of the strongest partners for public health for decades now. And we're honored to be able to work closely with their team to make sure this community has the resources they need.
Thank you, Dr. Fair. Good morning, everyone. My name is Andrea Moreno. I'm here on behalf of Supervisor Solis. She represents the 1st District in Los Angeles County, which includes Baldwin Park. The supervisor wants to extend her gratitude to Dr. Fair and the Department of LA County Public Health for organizing this important briefing. She would also like to thank Baldwin Park Mayor Emmanuel Estrada, District Manager of the SGV Mosquito and Vector Control District, Jason Farned, Dr. Halai, and Jose Escobar from the Department of Public Health, and all of you here today. We are concerned about the cluster of dengue cases identified in Baldwin Park and want to prevent the number of cases from growing. As you may know, dengue is contracted through the bite of an infected mosquito, and although it is not common in LA County, it is possible that there are other mosquitoes infected with dengue in our community. This is why prevention is very important, and luckily, There are ways you can prevent the presence of mosquitoes in and around your home. This includes getting rid of standing water where mosquitoes can breed, as well as utilizing mosquito repellent and long-sleeve shirts, pants to prevent mosquito bites. However, there is no need to panic. The supervisor is committed to ensuring the county is adequately reaching all of our communities so that everyone has the necessary information and resources to keep themselves and their loved ones safe. We will be working with the Department of Public Health and everyone here today to continue to extend preventative measures, as well as raise awareness around this important issue so that our residents can access testing, identify symptoms, and reduce the presence of mosquitoes in and around their homes. Your health and safety is our priority. Briefly in Spanish, brevemente en español. Buenos días a todos, mi nombre es Andrea Moreno, estoy aquí de parte de la supervisora Hilda Solís. Ella representa el primer distrito en el condado de Los Ángeles y incluye Baldwin Park. La supervisora extiende su agradecimiento a la doctora Ferrer y al Departamento de Salud Pública con el condado por organizar esta importante sesión informativa. Estamos preocupados por los casos del dengue identificados en Baldwin Park y queremos evitar que el número de casos crezca. Como quizás sepan, el dengue se contrae mediante la picadura de un mosquito infectado y aunque no es común en el condado de Los Ángeles, es posible que haya otros mosquitos infectados con dengue en nuestra comunidad. Por eso, la prevención es muy importante. Afortunadamente, existen formas de prevenir la presencia de mosquitos alrededor de su casa. Esto incluye deshacerse de agua estancada donde los mosquitos pueden reproducirse. Además de crear conciencia sobre este importante tema, la supervisora Solís está comprometida a que todos tengan la información y los recursos necesarios para mantenerse seguros a sí mismos y a sus seres queridos. Esto incluye acceder a pruebas, identificar síntomas y reducir la presencia de mosquitos dentro y alrededor de sus hogares. Su salud y su seguridad son nuestra prioridad. Muchas gracias otra vez de parte de la supervisora Hilda Solís.
Muchas gracias, Andrea. Ahora voy a introducir a José Escobar. I'm introducing José Escobar. He is the Regional Health Officer for this area, and he will also do a brief overview in Spanish. José, muchas gracias.
Buenos días a todos. Soy José Escobar, el oficial regional de salud del Valle de San Gabriel del Condado de Los Ángeles. Gracias a todos por acompañarnos esta mañana. Hoy compartiremos información importante sobre nuestra investigación y respuesta a un número de casos de dengue adquirido localmente que nunca hemos visto en el Condado de Los Ángeles. Agradecemos al alcalde Manuel Estrada y a la ciudad de Baldwin Park por su hospitalidad y por la colaboración mientras respondemos colectivamente a esta preocupante situación. También le damos gracias al Distrito de Control de Mosquitos y Vectores del Valle de San Gabriel por su colaboración continua y sus esfuerzos a la comunidad. Hoy les brindaremos una actualización sobre casos adicionales de dengue adquirido localmente identificado en la ciudad de Baldwin Park y lo que Salud Pública, el Distrito de Control de Mosquitos y Vectores del Valle de San Gabriel y la ciudad están haciendo para garantizar que las personas estén conscientes de la situación y tengan la información necesaria para evitar mayor transmisión del virus. Para empezar, Salud Pública reportó inicialmente un caso confirmado de dengue adquirido localmente el 9 de septiembre de este año en la ciudad de Baldwin Park. Esta semana se identificó 2 casos adicionales en personas que viven en Baldwin Park. Estas personas no tienen antecedentes de viajes a áreas donde el dengue se transmite comúnmente antes de tener síntomas. Con estos 2 casos adicionales se eleva a 3 el número total de casos adquiridos localmente en el Condado de Los Ángeles en el 2024. Las ciudades de Long Beach y Pasadena confirmaron previamente casos de dengue adquirido localmente en el otoño del 2023. Este es un número de casos de dengue adquirido localmente en la misma área que no se ha visto previamente en una región donde el dengue no ha sido transmitido comúnmente por mosquitos. El dengue es una enfermedad causada por un virus que se transmite a personas por las picaduras de un mosquito Aedes infectado. El dengue no se transmite de persona a persona. Aunque los mosquitos Aedes son comunes en el condado de Los Ángeles, los casos de dengue transmitidos localmente son extremadamente raros. La mayoría de los casos en el condado de Los Ángeles se han identificado en personas que han viajado a áreas donde el dengue ocurre comúnmente. Estos casos adicionales de transmisión local del virus son un recordatorio importante para todos los residentes del condado de Los Ángeles de que hay que tomar medidas simples para prevenir la reproducción y las picaduras de mosquitos y así reducir el riesgo de enfermedades transmitidas por mosquitos y prevenir una transmisión más sostenida en el futuro. Salud Pública está trabajando con agencias locales del control de vectores para mejorar la vigilancia e involucrar a las comunidades afectadas. Nuestros equipos están visitando a las personas que viven en los vecindarios en donde fueron identificados estos casos para compartir información sobre el riesgo de contraer dengue y también para motivar a las personas que tomen medidas para protegerse contra los mosquitos. Nuestros equipos también ofrecen pruebas de dengue gratuitas a todos los residentes visitados. Con la detección de estos 2 casos adicionales en la región, Salud Pública ampliará nuestra respuesta a hogares adicionales dentro de un radio de 150 metros de los casos recientemente identificados, que es el rango de vuelo típico de los mosquitos que transmiten este virus. Si nuestro equipo de salud pública visita su hogar, le pedimos que les permita compartir información con usted y hacerle una breve encuesta que nos ayudará a evaluar el nivel de hogar, la presencia de personas que tienen síntomas o personas que han viajado a lugares donde el dengue es común. Salud Pública también comparte información con los proveedores de salud y los alienta a mantenerse alerta ante el dengue y realizar pruebas y notificar casos sospechosos de enfermedades transmitidas por mosquitos. Aunque el riesgo de transmisión generalizada del dengue sigue siendo bajo, Salud Pública le pide a los residentes que tomen medidas sencillas para reducir contacto con los mosquitos. Estas incluyen usar repelente de insectos para prevenir las picaduras de mosquitos, eliminar el agua estancada alrededor de la casa donde los mosquitos pueden reproducirse y mantener su hogar libre de mosquitos usando o colocando mosquiteros en puertas y ventanas. Muchas gracias.
Muchas gracias, Jose. I'm also going to have Emma Chen come up, and she's going to very briefly talk in Mandarin for the residents who live here who speak Mandarin.
大家早上好，感谢您今天抽出时间来加入我们。我们将分享有关我们正在进行的调查和应对洛杉矶县前所未有的本地感染登革热的最新信息。首先，我们想要花点时间感谢 Baldwin Park 市的市长以及 Baldwin Park 市感谢他们的热情好客和合作，我们将共同解决这一令人担忧的情况。我们还要感谢洛杉矶圣盖博谷蚊虫和病媒控制区在社区中持续的合作和努力。今天我们将提供有关 Baldwin Park 市新增的本地感染登革热病例的最新信息，以及公共卫生部门、圣盖博谷蚊虫和病控区和市政府正在采取哪些措施，以确保居民了解情况并掌握防止进一步传播所需的信息。首先，公共卫生部门在今年的2024年的9月9日报告了一名 Baldwin Park 居民确诊的本地感染登革热病例。本周Baldwin Park 居民当中又发现了2例病例，这些居民在出现症状之前没有去过登革热常见传播地区的旅行史，加上这2例新增的病例，洛杉矶县2024年的本地感染病例总数已增至3例。长滩和帕萨蒂纳此前在2023年秋季确认了本地感染登革热病例。 对于一个以前从未通过蚊子传播登革热的地区来说，这是一个前所未有的令人担忧的本地感染登革热的集群。登革热主要通过被感染的伊蚊叮咬传播，虽然伊蚊在洛杉矶县很常见，但本地感染登革热的病例却极为罕见。登革热不会在人与人之间传播。洛杉矶县之前报告的几乎所有登革热病例都与前往登革热常见国家有关。这些额外的本地病毒传播病例提醒洛杉矶县的所有居民采取简单的措施，防止蚊子滋生和蚊虫叮咬，可以降低蚊媒疾病的风险，并防止未来更持续的传播。公共卫生部门正在与当地病媒控制机构合作，通过挨家挨户的信息宣传，加强监测，并让受影响的社区参与进来。我们的万年团队一直在拜访确诊病例附近的居民，用英语和西班牙语，以及根据需要或者其他的语言提供或者是分享登革热风险信息，并鼓励居民采取防止蚊虫的措施。我们的团队还为所有被访问的居民提供免费的登革热检测。随着该地区发现这2例新增的病例，公共卫生部门将扩大我们的外展影响范围，覆盖新确诊病例150米半径范围内的所有居民。这是传播这些病毒的蚊子的典型的飞行范围。如果我们的公共卫生万年团队到访您的家，我们希望您允许我们与您分享信息，并且回答一份简短的调查问卷，这将有助于我们在家庭层面评估是否有出现症状的居民，或者近期有旅行史的居民。公共卫生部门还与医疗服务提供者分享信息，鼓励他们密切关注登革热，检测并报告疑似蚊媒疾病病例。虽然登革热大规模的传播风险仍然很低，但是公共卫生部门敦促居民采取简单的措施，减少接触蚊子。这些措施包括使用驱蚊剂，防止蚊虫叮咬，清除家中蚊虫可以滋生的积水，以及使用或者固定门窗、纱窗，让家中没有蚊虫。谢谢大家。
Thank you so much, Emma. And we're happy to take questions. I want to note that I'm joined here with Dr. Sharon Balter, who is the head of our communicable disease division, who also prepared to take questions about other mosquito-borne illnesses as well. But, we're open for questions.
Sounds like you've got, you've tested some mosquitoes here. You've not found any positive cases with the mosquitoes that you've tested. I don't know the lifespan of a mosquito. I mean, do they transmit it to one another? Is it deadly for them? Somebody explain how that works.
We have all the experts.
Yeah, dengue is not transmitted between mosquitoes. They would need to pick it up from an infected person, and then it is transferred when a mosquito bites an infected person, picks up the disease, and then they can transmit that virus to other people.
So when you have so far tested negative mosquitoes, what does that tell you about the situation? Are you still suspicious that it may be out there?
Yeah, it's hard to say. Mosquito surveillance isn't the best surveillance for dengue, just the nature of the virus and how it's spread. But it's always good news that we're not finding mosquitoes that are positive. Our main objective right now is to reduce the mosquito population as much as possible because there may still be infected mosquitoes in the area. So by reducing the mosquito population and reducing the amount of mosquitoes that are infected in the area, then that will obviously reduce any further potential infection.
This question's for you. So it's still rare, not endemic, but I read in the press release with climate change, there could be a well, and that could happen soon. What is a well, and when could this happen?
I'm not sure specifically what you're speaking about with the well. I think where climate change comes in is that Aedes mosquitoes are invasive to this area. And so they were introduced into our area about 10 years ago, and they've been spreading up and down California. And as climate change and severe weather around the world impacts climate and mosquitoes' ability to find new homes and get situated in new places, different types of mosquitoes spread different diseases. And so every time you have a new mosquito introduced in a new place, then you have to take into consideration all the diseases that that area may not have had to worry about previously. Now there's a risk. For Aedes in particular, and dengue fever, dengue is at a record high around the world, and so as There are more dengue infections in other places in the world. People who are traveling in and out of LA County, there's an increased risk that someone may bring the virus back and get bit by one of our local mosquitoes.
But could it become a permanent thing here, like West Nile?
It could, sure, it could. I don't know how likely that is in the near future. There's no indication that that's going to happen anytime soon. As of now, it's still a very rare case. But we're trapping mosquitoes and working carefully with LA County Department of Public Health to track the human infection and the travel cases.
Thank you for those questions. I can talk a little bit about the comparison between West Nile and dengue. So they're both different viruses and have different transmission cycles. The problem with West Nile virus is that it's in our environment. It requires birds to continue the transmission cycle. And with dengue, it's transmitted between human and mosquitoes and back to human. So it's hard to compare both of them. At the same time, they're both mosquito-borne. With dengue, our worry is that if there are enough infected mosquitoes, it could lead to exponential spread because it does not require that animal in the intermediate. But the good news is that in other places in the U.S., such as Florida, Texas, Hawaii, the outbreaks that they've been small and limited, right? And so when we see local cases here, we want to act on them really quickly, identify additional cases in that area, if there are, and work with our vector control partners to control the mosquito populations rapidly so that it doesn't spread. As to the point of whether it will reach that critical threshold and cause an outbreak, that's hard to predict. But we know we have mosquitoes, we know we have travelers, and this recent cluster indicates that there is local spread that's occurring. So we need to be vigilant and we need to act rapidly once we identify that.
You mentioned earlier that most symptoms are mild, but what happens if you get it more than once?
So the second dengue infection is a risk factor for more severe disease. So once you get dengue once with one type of virus, you're protected lifelong from that particular virus. But there are 4 of them, so you can get it more than once. There is some data that the second infection has the highest risk of severe disease, but really severe disease can occur with any infection.
So if people travel, should we get the dengue vaccine?
It is not recommended for U.S. travelers. It is recommended only for children between 9 to 16 years of age that have had dengue in the past and are living in areas where dengue is currently circulating. It is not recommended for U.S. travelers, for adults, or those that are not living in dengue endemic areas.
What is recommended is that people who are traveling take protection against mosquito-borne illnesses. So you don't need to get vaccinated, but you do need to make sure you're using insect repellent. You're covering up, staying in places where you're trying to prevent insects from being While there's no recommendation on the vaccine, there is a recommendation that if you are a traveler, you be mindful, particularly if you're going to areas where there are a lot of mosquitoes, to protect yourself. So obviously, as I said, we have a lot of good options now on insect repellent. Everybody should be using it. If you're going to places where there are a lot of mosquitoes, you might need to use a mosquito netting when you're sleeping. There are steps that you could take. We have information on our website, but I don't want travelers to think, just go and don't worry. Everybody who's traveling, particularly if you're traveling to areas where there are a lot of mosquitoes, you need to take protections.
Can you repeat your theory as to how it got here?
A traveler. Go ahead.
Thank you.
Sure. So local transmission occurs when there's a traveler who becomes infected abroad and returns back to the county and gets bitten by a local mosquito that becomes infected. Now that infected mosquito can bite a person that has not traveled and result in a locally acquired case.
How many infected mosquitoes do you think are in the county right now?
There's no way to say.
We don't know.
Yeah, I can say it on the mic, but there's no way to know. Yeah, just know that everything that we've collected and tested so far has been negative.
So is there a map that shows where the 3 people were?
We cannot share the exact location for patient privacy.
Can you say San Gabriel Valley? Are we in ground zero right now?
They're in Baldwin Park.
It's in Baldwin Park, the city of Baldwin. So every case, King County is right here in Baldwin Park? Yes. 3 cases. Right here. And has there been success on releasing the sterile Aedes mosquitoes? And where have they been released, the sterile ones?
Yeah, so I can only speak for San Gabriel Valley Mosquito and Vector Control District, but what you're referring to is SIT technology or sterile insect technique, and what mosquito and vector control agencies across California are looking into is the ability to sterilize male mosquitoes, release them into the environment. Male mosquitoes do not bite. So by releasing sterile male mosquitoes, they will mate with wild females and make their eggs infertile or do not produce offspring, which will hopefully or theoretically reduce or crash the population. And so that's emerging technology, and as it becomes more available, we hope to eventually add that tool to our toolbox. But as of yet, San Gabriel Valley is not releasing sterile male mosquitoes into the environment.
You can talk about Greater LA.
Okay.
You have a pilot.
Yeah, so Greater Los Angeles Vector Control District, which is another LA County Vector Control District, they do have a pilot program where they're starting to do this work.
And are people able to use their backyards again or be outside in a dress or in those neighborhoods where they've tried the pilot program?
Yeah, it's still very, very localized, and so and then the pilot program is still very, very young, and so I don't have the results of anything particular. But in the near future, this will be a very, very targeted and localized pilot program.
And what are the months of this mosquito?
Mosquito season is starting earlier and earlier and ending later and later, generally between March and April all the way through October. Invasive Aedes aegypti, tend to peak a little bit later in the summer and early fall, and so September and October, August, September, and early October is the peak season for this particular type of mosquito.
Do you think it can continue through the holidays?
No, we're really looking for weather. So when nighttime temperatures drop below 50 degrees, the water which the mosquitoes are growing, it's not conducive for them. It slows down their growth cycle, and eventually it gets too cold for them to reproduce. So as soon as the nighttime temperatures are consistently in the 40s or low 50s, we see mosquito populations crash.
All mosquito populations crash? You don't need a freeze?
No, we don't need a freeze, and we still do find mosquitoes in the environment year-round, but usually as far as disease prevalence and also nuisance biting, it goes away during the winter. Yeah.
Did the heat wave impact this at all?
Yeah, the heat wave generally does impact mosquito populations in a couple of ways. The hotter it is outside, once we get into triple digits, mosquitoes don't like the heat either. So they're resting, it stresses them out a little bit, and so we actually see nuisance and population decline a little bit. But mosquitoes are still growing in backyards and in water sources. The warmer the water is, the better it is for the mosquitoes. But the heat does stress the mosquitoes out a little bit, and they tend to rest in the shade a little bit more than coming out and biting us.
Are you finding them more at homes that have grass where they're watering versus people that have put drought-tolerant landscapes in? Is there a difference in the amount of mosquitoes in each yard?
Yeah, a very big difference. So Aedes mosquitoes are an urban mosquito. They actually prefer to live near humans. We find them mostly in backyards, growing in very small containers. Everything that you have in your backyard, from buckets to flower pots, old tires, normal things that people have in their backyards that fill with water, will grow these mosquitoes. And so throughout California, there are a lot of different types of yards. We have drought tolerant, on one end, with just cement or very lush yards. And so the more water that can fill these containers through sprinklers and other ways will grow more mosquitoes. And then the more foliage that you have and the more shade that you have will allow places for these mosquitoes to rest and be comfortable. And so both water and vegetation will be a much more be a much more better environment for these types of mosquitoes, and we see more in those types of yards than we do with sparse vegetation or drought-tolerant landscaping.
If there are no more questions, we'll go ahead. Well, thank you. If you need to speak with one of the experts, they're here for a few minutes, so just let us know. But we appreciate all the help you're giving us getting the word out. So thank you. I want to again extend my gratitude to the mayor. So Mayor Estrada, muchas gracias. Thank you for having us here and also for the close partnership. So thank you, everyone. Have a great day.
We have press releases.